implant plastic and reconstructive surgeon. Ideal Implant is the newest technology in breast implant surgery in the last 25 years. Only about 100 pairs of implants have been put in patients across the country. All right, so I'm getting ready to make the incision, and we're going to start with the right breast. The reason that Ideal Implant is great because it has the look and feel of a silicone gel implant, but there's no silicone in the implant. There's a baffling system. The baffling system allows you to have saline in multiple compartments.
If this is the ideal implant, who is the ideal candidate for the ideal implant?
The Ideal Implant can be put into any woman who wants the look and the feel of a silicone gel implant, which is why Julie came to me in the first place. But it may be apprehensive because of the risk.
Okay, now I understand that silicone implants are legal, but silicone injections are not, and particularly silicone injections that the cops say are a grade above caulking material.
Yes, Jane, you know, I think it's very important to make a distinction between solid silicone implants, silicone breast implants, and free silicone injections. Free silicone injections are very dangerous. Silicone breast implants that we put in for breast augmentation, for breast reconstruction, and cosmetic breast augmentation are FDA-approved devices that have been tested and proven safe for years.
We sent Shelby to see plastic and reconstructive surgeon Dr. Kevin Brenner to finally get that nose she had always wanted.
Your story is a very common problem among teenagers seeking plastic surgery. Now that you're 17, your face is fully grown. This is actually a really good time to address these problems.
To have it just be normal, it would make me so happy.
Shelby is such a sweet kid and really a very attractive young girl. And when someone's self-esteem is so low because their peers making fun of them, I really, really hate seeing that. And what we're doing for Shelby today, sure, it's an aesthetic operation, but really what it's going to do for her is boost her self-esteem. And for Shelby, the other important thing, which she didn't really complain about because she didn't get teased about how well she breathed, but her breathing really wasn't very good. She not only had a deviation of her septum, but she had what we call valve collapse, where the cartilages are sitting too close to the septum. We take out a portion of that, but it's real important to leave enough structure in there so that her nose doesn't collapse.
Courtney Cox sure doesn't look like a woman about to turn 50. In part, that's because Cox has admitted to undergoing alt therapy. No knives, no lasers. Alt therapy uses ultrasound technology. Look at how the skin around her neck stays tight.
Here at Roxpa, we're seeing a huge demand for alt therapy, especially moving into award season. This is a great treatment that is minimally invasive, minimal discomfort, and it's something that you can do and be red carpet ready within a week.
Board-certified plastic and reconstructive surgeon Dr. Kevin Brenner says alt therapy is great for people who don't need a facelift just yet.
So think about it. Would you ever stick a needle just right into your face on your own or under your eyelid? That is what my next guest does to stay young. Now I'm bringing in a life changer, Dr. Kevin Brenner. He's a board-certified plastic and reconstructive surgeon in Beverly Hills. What do you think about what she is doing to herself?
So this is crazy. I mean, honestly, you're really running severe risks here of seriously harming yourself, injecting yourself with Botox or actually with anything. You can really, really harm yourself. You can go blind if you inject in the wrong place. You can cause your eyelid to pull down.
Are there ever any arterial injections or venous injections that cause really severe systemic complications?
Well, there shouldn't be with Botox. But if you don't know what you're doing and you inject in the wrong place, there is an artery right below your eye, on the inside of your eye, that if you inject it, it goes right to your retina. And people have gone blind from embolisms, where the drug actually goes into the artery right to your retina.
When doctors have a board certification in whatever field, it gives you the assurance of a particular level of expertise that they are held to. And in plastic surgery, you want board certification in plastic surgery.
Angela Milligan is 44, a mother of 2 grown children, and now she wants in on Hollywood's latest plastic surgery trend, the mommy makeover.
We are seeing a much bigger trend toward celebrities having plastic surgery for mommy makeover issues as well. Changing the
Dr. Kevin Brenner, board-certified plastic surgeon, says a mommy makeover usually involves a tummy tuck and breast rejuvenation. No implants, just a lift.
We're getting ready to start the whole mommy makeover. I'm going to start with the tummy tuck, and then we'll move on to the breasts.
It is intense surgery running about 6 hours. For those seeking the quick fix of a mommy makeover, click on mymommymakeover.info or drkevinbrenner.com.
If you're thinking about having more children, you probably don't want to have this done because having a subsequent pregnancy can undo all the good work that was done.
Breast augmentation surgery now done faster and simpler with this new implant device that's taking the beauty biz by storm. It's called the Keller funnel, and Beverly Hills plastic surgeon Dr. Kevin Brenner thinks it will forever change the way breast implant surgery is done. Dr. Brenner says pushing the implant through this device does more than just allow him to make a much smaller incision.
It decreases the length of the scar. It decreases the amount of time it takes to put the implant in, and it decreases the risk for contamination of a sterile implant.
Board-certified Beverly Hills plastic surgeon Dr. Kevin Brenner didn't perform these surgeries, but does work on celebrities.
When celebrity patients come in the office, oftentimes we'll have to maybe adjust the time that they come in, either have them come in at the early portion of the clinic hours or even at the end of the day so that they don't run into other patients.